right now. And to get things started, let me pass it on to Dr. Damien Chase-Begay. Damien?
All right. Good afternoon, everyone. Thank you for being here. Just wanted to remind folks before we get started of next week's topic. So next week on March 11th, our seminar will actually be myself and Dr. Tony Ward hosting a panel. And we are going to be exploring the Missoula Academic Health Department's response to addressing houselessness in Missoula with a panel discussion and a project update. So we look forward to seeing you all here next week. And I am going to pass it over to Curtis to introduce our speaker. I just want to quickly say, though, asbestos is not my area of study. But as somebody, who lost a grandpa from pleural mesothelioma from occupational exposure to asbestos, I'm really interested to hear the presentation today. And so I'll turn it over to Curtis to introduce our speaker.
Thanks, Damien, and I'm sorry to hear about your grandpa. I'm excited to introduce Tracy who's going to be giving her informational seminar. Tracy is a PhD student in the School of Public and Community Health Sciences. I guess I've known Tracy for quite a long while now. And she is currently the executive director of the Center for Asbestos-Related Diseases, and I'm sure she'll tell you more about that. I don't want to steal her thunder, but she does great work. And her whole team up there does fantastic work in terms of providing healthcare services and screening services to individuals that were affected by this really fascinating but tragic history that occurred right in our own neighborhood in Northwest Montana. So I'm just going to turn it over to Tracy now and take it away.
Right. Thank you. And you can see the presentation okay?
Yeah, looks great.
Thank you. I decided to call it Clearing the Air About Asbestos because every year Card Clinic goes to the American Public Health Association, and we're always completely shocked as the people stop by our table. It's just an information booth, and they ask really simple questions and things that we thought that sort of everybody knew the answers to. So I did kind of a frequently asked questions, and then I added quite a bit more science than I would have done at like an educational booth. But and that is ampable asbestos fiber there. So like Curtis said, I work for the Center for Asbestos-Related Disease. We're a nonprofit that started in 2003. Our primary funding is from the CDC, Agency for Toxic Substances and Disease Registry, and it's a grant that provides free asbestos health screening and lung cancer screening. And ongoing pulmonary care is done separately. That's a fee-for-service thing that we do, and then outreach, education, and we like to focus on research a little bit so that we can try to improve our understanding and our treatment of asbestos-related disease. That is our staff. And our mission is providing advocacy, care, resources, and hope to the community and all those across the nation impacted by Libby amphibole asbestos and asbestos-related diseases. So we do focus on Libby amphibole, but we also focus on general asbestos exposure. So this is a little introduction to Libby asbestos, so I don't have to spend 5 slides doing a background. It's just 2.5 minutes long, so hopefully you can all hear it. If not, please stop me.
Libby, Montana is like most small towns in America. What sets Libby apart, though, is asbestos. Lots of it. Vermiculite ore, which was mined and processed there for over 70 years, is contaminated with tremolite, a naturally occurring, relatively unknown form of asbestos.
You can see all these areas of plaque.
Escalated occurrence rates for lung cancer, asbestosis, and mesothelioma in the community prompted US EPA to dispatch an emergency response team to Libby in 1999.
And what we found shocked us. We expected to see something that was limited to workers or former workers, but what we saw was a problem that had spread around the community, and disease rates that were 40, 60 times the national average. And we've been working on it ever since. And we found that the vermiculite contained quite a bit of asbestos, and it had found its way into the town in various places, in people's homes, in the schools, in the parks. And we've been working on that ever since.
In its heyday, the Libby mine produced 90% of the world's vermiculite, which was processed and marketed as building insulation and a soil additive.
It was sold commercially all over the world, but here in Libby, Montana, where it was produced, of course, people could back their pickups right up to the processing plants and load the pickups up and take it home. The stuff is just all over Libby, Montana. People have used it for everything. As attic insulation, in walls, put down, just loose on driveways. It was used as a soil amendment in yards and gardens around town. You just really find it everywhere.
Literally hundreds of people have died and thousands of people are affected by this asbestos to some degree.
I went out and turned my flag upside down, and I was very severely criticized that I was disgracing the flag, which I would never do. I served under that flag and would again, saying that was just my little protest and calling attention to the plight of my family and others.
Oops. Okay. So what is asbestos? The World Health Organization defines asbestos as it's a generic term for a group of 6 naturally occurring fibrous minerals with high tensile strength, flexibility, and resistance to heat, chemicals, and electricity. So there are 6 different kinds. That's chrysotile. That's the main one that was used in lots and lots of industrial applications. Amosite, chrysotolite, tremolite, actinolite, and anthophyllite. And those are all a different kind of asbestos. They're amphiboles. Chrysotile is a serpentine. And I have a picture of that coming up in a little bit. The one that is sort of Libby is tremolite. So we have a little bit of tremolite in our Libby amphibole. So it is primarily winchite in Libby, and then richterite, and only 5% tremolite. And the little chart just kind of explains that it's a sort of a solid solution. And so a lot of these minerals can't really be classified simply, which is a problem because asbestos is defined by historical mining and use in commercial products, which means that it leaves other things out, like Libby amphibole, our vermiculite, talc, silica, carbon nanotubes. All of those fibers and particles may have health effects, but they're not called asbestos. Therefore, any asbestos regulations don't apply to them. So history of asbestos, I love this little picture on the left. So they used to use asbestos as fake snow, like the Wizard of Oz when it's snowing. That's asbestos snow. And they knew about it for a really long time in ancient Greece and in ancient Rome. And I don't know how they figured this out, but it is from EPA. So I think it's real. It became a common construction material, though, in the late 1800s. They found big deposits in the United States and Canada, and it was really cheap to produce. So they started putting it in a lot of stuff. It was in roof and ceiling tiles, flooring, cement, and mastics. That's like glues that like stick your floor tiles to the subfloor and other things. Brakes, it was used as fake snow, oven mitts, insulation, acoustical plaster. And this is just some interesting ads. So it was called the magic mineral for many years. At the World's Fair, they had a fire dancer who was wearing an asbestos suit. That's what the top left one is. And then in the United States, at least, it was the 70s when we really started to figure out there's a real problem here. So this is a picture of Dr. Selikoff. He's a New York doctor at Mount Sinai Hospital, and he worked with insulators. So the people that worked on those asbestos covered pipes doing like heating. And he followed that. It was a union, so he followed them medically. And he's the one that really put together what happens with the asbestos exposures. So he did quite a few publications. I just have 3 of the bigger ones here. We still, to this day, we work with a doctor named Albert Miller, and I will have a slide later with some of his work on it, but he trained with Dr. Selikoff and worked with him. And we even still have some samples from Dr. Selikoff's cohort. So it's still pretty relevant to what we do here. So how much of a public health problem is asbestos? A lot of people seem to think it's a problem of the past, but it's not. This graphic is from the Asbestos Disease Awareness Organization. And I liked it because, like, you think of airplanes and football teams, right? So it's really helpful to understand how many people actually suffer from asbestos-related illnesses. So 30 Americans die each day, and 10,000 Americans die each year from preventable asbestos-caused diseases, including lung cancer, mesothelioma, and other cancers. So key World Health Organization facts. So this is globally. About 125 million people in the world are exposed to asbestos at the workplace. More than 90,000 people die each year from asbestos-related lung cancer, mesothelioma, asbestosis, and these are all from occupational exposures. All forms of asbestos, including chrysotile, are carcinogenic to humans. So for a while, there was arguments in the legal world that chrysotile is okay. Amphibols are bad, but chrysotiles are okay. So that's why World Health Organization makes that distinction that chrysotiles are also carcinogenic. And several thousands of deaths can be attributed annually to exposure to asbestos in their living environment. So that's what we see mostly in Libby is environmental exposures. And I have a few numbers about that later too. So how do you identify asbestos? This is the middle of this is the diameter of a human hair. And then the asbestos fiber is that tiny thing next to it. So basically you can't see asbestos, you can't taste it, you can't touch it. You just have no idea it's there. You cannot detect it. So on the left is what I was talking about, the amphibole fibers, and on the right are the chrysotile fibers, the serpentine. So you can see the difference in the shape of them. And again, the one on the left is the one that we have in Libby. This is just a little more description of how small asbestos fibers are. So the middle is where you start, and then on the top left, you zoom in a little, and on the bottom right, you zoom in quite a bit so you can see the fibers themselves. So if you can't detect asbestos, you have to test for it. So this is a graphic again from Asbestos Disease Awareness Organization. It shares the places where you could find asbestos in a home. So things you should know are use a certified asbestos inspector. The state of Montana regulates that and they train them. And you have to use a certified laboratory as well. Most laboratories don't test for Libby amphibole. They only test for the 6 regulated fibers. So if you want to test for Libby amphibole, it's a separate test. Places that might need to be tested are old buildings, industrial facilities, and construction sites. And when you would test are when you're doing a renovation or a demolition. If you're doing a real estate transaction, they'll often want asbestos testing. If there's suspected exposures, like humans that have a concern about whatever the insulation or whatever, you would want to test, and for regulatory compliance. So like schools, for example, always have to have an asbestos plan in place. So they have to test. So do all asbestos containing materials need to be removed immediately? And most people think this answer is yes. We have quite a few people that come up to us and go, well, I know that there's asbestos in my school, but they're not removing it. So it's actually often better not to remove it because you want to prevent the release of fibers into the air. So the graphic on this one isn't very good, but the difference is what's friable and what's not friable. And friable just means that it can get into the air. So the one on the left, you can see that it's cut on the end, and that can get into the air because it's loose. The one on the right is not loose, it's all still there. So it's often safer if left undisturbed by encapsulating it or sealing it. And in Libby, we had cleanups both inside of our homes and outside on our properties. And most of the asbestos in walls was actually sealed in, which can be a problem later. But as far as exposures to people living in the house, it's better because it's less cleanup at the moment and less asbestos getting into the air during the cleanup. So abatement and disposal, this is a picture from EPA of them sucking the Libby amphibole out of an attic. And that has to be taken to special landfill cells. So Libby's landfill has some, but most landfills don't. So it can be pretty expensive to dispose of asbestos containing materials. And it has to be removed by licensed contractors. So the public health issue that we have in Montana is that there's a homeowner exemption. So if you're a homeowner and not a contractor, you don't have to test and you don't have to use a licensed contractor. You just can do whatever you want, which is concerning because a lot of people don't necessarily even think to test for asbestos. So it's a big issue for public health as far as letting people know that if their home is built like before the 1970s, that they should really think about asbestos before they just start doing DIY work. So is asbestos banned? The answer to this one is also no. So this map shows, this is a 2019 map, and the countries that have fully banned asbestos are in green, and you will note that the United States is not one of them. So asbestos isn't banned, but it is regulated, and it's regulated by a bunch of different agencies. So this one's kind of a heavy slide, but I'll go through it real quick. The Toxic Substances Control Act regulates the manufacture, distribution, and use and disposal of asbestos. The Clean Air Act dictates emission standards, waste management requirements, and risk assessment strategies. Aire is Asbestos Hazard Emergency Response Act. That's the one I was just talking about in schools. So they have to have a plan and train their staff. And their plan is often to, it says to manage asbestos. So often it is to leave it there, just make sure that it's encapsulated. OSHA is Occupational Safety and Health Administration, and they think about workers. So their regulations are for workers specifically. So they have a permissible exposure limit of 0.1 fiber per cc over 8 hours. And that's for long-term exposure. And then they have a sealing or excursion limit of 1 fiber per cc over 30 minutes, which is short-term exposure. And then CERCLA is a Comprehensive Environmental Response Compensation and Liability Act. So that's our Superfund law. And so we've had lots of CERCLA activity in Libby since 1999. So they regulate and fund the cleanup, and they address liability. So in our case, it was WR Grace. So they had WR Grace pay for a lot of the cleanup, and they also encourage community involvement. And then lastly, there's DEQ, and they operate the state asbestos control program, including the regulations and licensing for the contractors and the testing people. So this is fun. This is a new page test at TSCA. The Toxic Substance Control Act was updated in 2023. And it is the first time outside of CERCLA law that Libby Amphibole has actually been regulated. So we were pretty excited that Libby Amphibole got put in this document, but it also says, therefore, small manufacturers and processors of Libby Amphibole asbestos continue to be exempt from reporting. So we're there, but it doesn't really do us a whole lot of good. But we're excited that Libby Amphibole is sort of now regulated. So EPA Aire is their integrated risk information system. So they do basically it's a toxicological information on all kinds of different toxic substances, and it's available at epa.gov. For asbestos, they have one, and it's all types of asbestos regulated, so not Libby Amphibole. And that is 2.3 times 10 to the negative 1 fibers per milliliter. So that basically translates to if an individual is exposed to asbestos fibers at a concentration of 1 fiber per milliliter of air over a lifetime, their risk of developing lung cancer and mesothelioma, those are the endpoints they worked with, from that exposure is estimated to increase by 23%. And I think I didn't put a smoking slide in here, but that increases pretty significantly if you're also a smoker. So EPA also did an Aire for Libby Amphibole. So at our Superfund site, there was 8 operable units. 2 of those were towns, so Libby, Montana and Troy, Montana. The other ones were like the railway corridor, the highway corridor, the expansion plants, those sorts of things. But the properties needed to be cleaned up, and so they had to do an Aire so they knew how well to clean it up. What's the limit? So they cleaned 2,600 properties. They tested 8,100, and their cancer inhalation unit risk was 1.7 times 10 to the minus 1. So that actually is less. So you can have more exposure, more exposure to Libby Amphibole than general asbestos. So that was surprising to us. So it's a 17% increased risk versus a 23% increased risk with Libby amphibole. But they also did a non-cancer reference concentration, which they didn't do one for general asbestos. And that one is concerning. So that's 9 times 10 to the negative 5 fibers per cc. So basically that's 0.00009 fibers per cc that can be in the air. And if it's more than that, there's a chance that you're going to develop asbestos-related disease, non-cancerous asbestos-related disease. So in Libby, for many, many years, there was a lot more than that in our air. So the IUR and RFC were developed based on studies by Lockheed, and he worked with a cohort of people that were at a processing plant in Marysville, Ohio. And they were using the vermiculite to put into potting soils. So does fiber size matter? Sorry, I heard a question. Only about 50% of fibers in the sample of Libby amphibole fall within the range used by EPA to calculate risks. So EPA cleans up based on their calculated risk, which means ongoing monitoring of disease development is important. So we don't really know for sure if fiber size matters. EPA felt pretty confident that it didn't, but we're not 100% convinced. So it's important for us to continue to monitor the site and make sure that these fibers that fall outside of EPA's ones that they did all the risk assessments on don't show disease. So this is the Libby Asbestos Superfund site. So you can see the town of Libby in the middle, the town of Troy just to the left of it, and all the green outlines are the outlines of the Superfund site. So most of those have been removed from the national priorities list now. They're just basically working on the mine site, which is all the way to the right of this map. And these are just some pictures of the old mine when it was in operation. The top one on the left is a piece of vermiculite, and then the vermiculite expanded on the right. And so what they do is they heat it up really hot and it expands like that. And that's when it releases the asbestos fibers. So the processing plants were one of the main places where people could get exposed. The middle map on the left, it just shows all the places that Libby vermiculite was shipped to. And on the bottom is a conveyor belt from the mine site across the river over to railroad cars where they would ship it out from. And these are just some pictures of exterior removals that happened in Libby. So they removed more than 1 million cubic yards of soil from people's gardens and yards and that sort of thing. And they hauled it back up to the mine site because it's very difficult to dispose of, and they hadn't done the mine cleanup yet. So now they're covering over that. So today, because asbestos, even though it's not completely banned, it is highly regulated. The problem is really legacy asbestos, and that's all types, Libby amphibole and all the other asbestos products. And the term legacy means that asbestos for fibers remain embedded in buildings, infrastructure, and products across the United States. EPA estimates that 35 million homes, schools, and office buildings still contain asbestos, and it doesn't go away. So someday when those become friable, people are going to start getting exposed and it's going to have to be cleaned up. So it's just really paying attention to when that happens and making sure that there are processes in place to do it. This is a big public health issue because right now there really aren't very good processes in place to do this or to test for it. And everything's extremely expensive. Like I said, you need special inspectors, you need special labs, you need specially trained cleanup crews. And then naturally occurring asbestos is also an issue. So this is an ATSDR map that shows naturally occurring asbestos throughout the United States. And this doesn't include other things that aren't asbestos. So I was talking about like Aire and other products that they're naturally occurring and they still can cause health issues, but they aren't included on this map. So what are the risk factors for exposure to asbestos? Living in an older home with friable asbestos or potentially friable asbestos containing materials. Again, it's hard to know because you can't detect asbestos without a lab. But if you do have anything that's starting to degrade and fibers can become airborne, it's good to have it tested. Occupations such as firefighters, insulators, mechanics, and abatement workers. Mechanics, there's a lot of asbestos in brake pads and a few other things like gaskets and stuff in vehicles. Military veterans are often exposed, especially shipyard workers. Family members of those with known heavy exposure. So in Libby, we had the miners who would come home and their wives would wash their clothes for them. And so we saw a lot of exposure that way. Recreating outdoors near naturally occurring asbestos. In Nevada, there was a big issue with people. Anything horseback riding, four-wheeler riding, anything that kicks up dust around that naturally occurring asbestos can cause exposures. Living near a historic mine site, one of Libby's processing plants, or other industrial sites can lead to exposures. DIYing, disaster victims. So when a disaster hits, things fall apart, right? Like literally houses fall down. And so that can release fibers. And using products that may contain asbestos, such as talc. So risk factors for asbestos-related diseases include the intensity of your exposure. So if you have a huge exposure, there's more likely to be disease than if you have a very minimal exposure, and the duration of that exposure. So in Libby, that's where it was a problem because we had asbestos in the air for years and years. And so the duration of people's exposure was really long. The type and size of the fiber matter. Genetic factors matter, smoking history, your general health status, and your age. And that can be because it takes a while to develop asbestos-related disease. So if you're exposed when you're older, there's less chance that you're going to live to the point where you develop the disease. There's also been some research about younger people whose lungs aren't fully developed yet and whether they're at higher risk. So what does asbestos do to the body? Asbestos fibers enter the body through inhalation, ingestion, or dermal exposure. So basically you breathe them in, you swallow them, or you touch them, or they touch you. Inhaled fibers can migrate through the tissues and become embedded, which leads to a chronic inflammation response. So the body tries to resolve that, but cell damage and inflammation can occur. If resolution fails due to the continued biopersistence of these fibers, which it usually does, mutations from inflammatory damage can accumulate over time and cause scarring and cancerous changes to the surrounding tissues. The same process is basically what happens with ingested fibers as well. It's just not as common. And dermally implanted fibers generally only just turn into calluses or corns. So that one isn't as much of a concern. So what are the health effects of asbestos exposure? There are two main health effects, and these, of course, are by inhalation. So those are cancers. Well, not all of them are inhalation because there's stomach and colorectal, but cancers, the main one is mesothelioma. That's the one you see all the TV commercials about. And that's because it is the one that is specifically related to asbestos. If you have mesothelioma, it can be assumed that it was caused by asbestos versus lung cancer, which can be caused by asbestos, but it can also be caused by a bunch of other things. So larynx and ovary, those are the ones that the CDC recognizes. And then I'll talk a little bit more about our Medicare program in Libby. But Medicare also recognizes stomach, pharynx, and colorectal cancer as asbestos related. So the other health outcome is non-cancer, and those are asbestosis and pleural disease. Pleural disease can be plaques or thickening, and then also benign pleural effusions. So on the right is a chest x-ray, and there's a mesothelioma on there. The other interesting thing that I didn't put on the previous slide is autoimmune disease. And that's because autoimmune disease isn't associated with chrysotile asbestos exposure, but it is associated with amphiboles. So research has demonstrated that autoimmunity is an important aspect of health outcomes with Libby amphibole exposures. Screening for autoimmune markers may allow early detection or estimation of long-term risks of severe disease. And research is bringing us closer to potential treatment. So we were actually pretty excited to find this out because autoimmune disease is something that can be treatable. And generally, asbestos-related lung disease isn't very treatable. It's just symptomatic treatment. So this is kind of good news. Autoimmune outcomes are less well known, but they are pretty high frequency with other amphiboles, including crucidolite and fluoroedenite from Italy. So on the right are just a few articles that were written and some data. And I know it's small and it's hard to see, sorry. So imaging, one of the ways we look for asbestos-related diseases through imaging. So you can do a chest x-ray or you can do a CT scan. On the left is a CT scanner. It's the little tube that they put you in. And the chest x-ray, you just stand up against the wall. It's sort of like having a dental x-ray. CT scans, you get more radiation. They're more expensive, but they're also more sensitive and specific. And they are considered the gold standard for diagnosis of asbestos-related disease. Chest x-rays, on the other hand, less radiation, less expensive, less sensitive and specific, but they're considered the standard for a screening program. So I'll go through our screening program in a minute, and you'll see that we do a chest x-ray and often a CT too. It is because the chest x-ray is sort of the first line of screening. So this is what asbestosis looks like on a chest x-ray on the left or a CT scan on the right. So if you haven't looked at a CT scan before, picture a person laying down on their back with their feet facing you. So you can see their spine at the bottom of the picture and their heart at the top of the picture. And then it's their lungs that are the dark colors. And the asbestosis is all of the white stuff throughout them. That's not normal. Pleural plaques. Pleural plaques, especially with chrysotile exposures where you see these, and they often don't have many health impacts. They're described as a marker of exposure, but they're pretty noticeable. On the right, on the CT scan, you can really see those things sticking out in the black area. The black area is the lungs. Those white things sticking out into it are the pleural plaques, and there's little arrows there. And then on the chest x-ray on the left, those are en face plaques, which means they're the plaques that are on the front of the chest, so you can see them on a chest x-ray. And then this one is pleural thickening. So this is more what we see in Libby, and it's a lot harder to see than those plaques. And that becomes really important as time goes on in Libby because it becomes controversial how to identify it. So this is a surgical picture on the right of somebody who had to have, I can't remember, I think it was a lung cancer surgery, but we got pictures of the pleural thickening from the surgery. And there was a paper written on this one. So reader agreement, as I said, it's hard to see that pleural thickening. It's not like the big pleural plaques that you see from chrysotile asbestos exposure. So over the years, we've had our asbestos health screening program for 13 years. And so on the bottom, these are the years. And on the left is the kappa score. So that's just the agreement between the readers. And you can see the left graph is CT scans and the right graph is chest x-rays. And you can see that it's kind of varied over time. They don't always agree. Sometimes it's good agreement, sometimes it's not as good. And then the last few on the CT scans, we have a new panel of doctors, the 3 doctors that read them. And so that's why the agreement has really dropped off in the last year and a half. But we do expect that to improve again as the doctors start working together and getting, they get on the same page. That's why they all read the same images and then they discuss what they see differently. And so the intent of this program is for them to improve their agreement over time, which maybe it has a little, but in general, it's not as easy as you would think it would be. I'm having trouble changing my slide, sorry.
I know sometimes if I use my mouse and actually click on the slide, it'll like kick it into, I don't know why, sometimes it just lags and
Yeah, I'm clicking on the slide and everything. I'm not sure.
Try that arrow, try the arrows on your keyboard, maybe.
Yep, I tried that too.
Oh, sorry.
Okay.
Shoot.
I don't know.
Spacebar is a last
Space
resort
bar.
also.
No.
Nothing.
Huh.
So you
It might escape
take
and
it-
then start
yeah.
again.
take it out of
Yeah.
presentation mode or whatever. Please stand by.
Okay.
Sorry about that.
And I'll just take this moment to let folks know, if you do have questions and you want to put them in the chat, please feel free to do so. I'll read those off at the end. But you can also at the end, we'll have time for you to unmute and ask questions if you'd like. And looks like hopefully we're getting it back up and running.
Yeah, sorry about that.
No, that's
Sorry.
fine. Technology.
Okay, I'm gonna zoom back down to where I was. Okay, so this is an article by Dr. Albert Miller that I was talking about that worked with Irving Selikoff. And he just points out that chrysotile exposure has those different plaques. That's the picture on the left of the CT scan. And then the amphibole exposure is more pleural thickening, which is the picture on the right. And not a doctor, but I've worked with them for years. And so the way you can tell that there's pleural thickening on that CT scan on the right is if you look at these white things around the outside, there's little white, basically dots. Those are your ribs around the outside of the lungs. And between the ribs and the lungs, there's an extra layer. So that layer is your pleural surface, and that should be so thin that you really can't see it on a CT scan. And you can see that even in some places, it looks a little calcified. So calcification is white on a CT scan. So historical Libby related data, I won't go through these. This is just kind of to show that there's been a lot of studies on Libby. There's probably about 200 altogether, but these are some of the major ones. Card's role in research. So at the clinic, we like to encourage research, like I said, because it helps us be able to treat our patients and understand their disease better. So we establish, organize, and maintain ongoing medical surveillance information in a central database. Everybody who comes into the clinic is asked if they'd like to participate in research. And we have a really, really good rate of people that say yes. So that's nice. We have a huge database. We encourage investigators at federal and academic institutions to consider research to advance our mission, like I said, which is to help people with asbestos exposure and disease. If proposals are approved and funded, CARD will help facilitate and coordinate access to the clinical population. We are active liaisons between researchers and the community, which sounds simple, but honestly, sometimes it can be a really difficult thing to translate. And then we partner for implementation and publishing and dissemination of results. So we like to have community events where we explain the results of any research project that we do through the clinic. And this is just one project that we've been working on. And it's a pleural thickening CT analysis project. So we work with Cornell Engineering, and they already have a program where they can look at coronary artery calcifications, breast densities, all kinds of things on CT scans, but they don't really look at pleural disease yet. And so we're developing that with them right now. And these are just kind of some visualizations of what it looks like. And what happens after you're exposed to asbestos? So at first, primary prevention, we want to avoid more exposure, of course, stop smoking, because like I said, that is additive, actually more than additive chance of cancer if you smoke and you're exposed to asbestos. Counseling, support, and education, and vaccines are super important. So influenza, pneumovax, COVID vaccine, RSV vaccine. The screening programs are asbestos health screening. We also do colon cancer screenings and then lung cancer screening. And then tertiary prevention, just regular monitoring for progressive fibrosis, cancers, and pulmonary function decline, use of inhalers, oxygen, cough suppressants, pain medications, and antibiotics. In our clinic population, we try to treat a little bit more than others would with antibiotics, just because these people have underlying respiratory disease. And so if their disease is, well, if whatever infection they have exacerbates the disease, it makes it much more difficult for them to get over, and they'll have lasting effects. And then pulmonary rehabilitation and changes in diet and exercise, of course. So latency is important because it can take 10 to more than 40 years after you were exposed before your symptoms develop. Risk of disease increases as time goes by. So you're less likely to have disease, of course, at 10 years, but at 20, 30, 40 years, you're going to have an increased risk of developing the disease. And that's important because it makes it really hard to catch disease early, because like asbestos is undetectable. So you have to know there was exposure. And then it's hard to link the disease to the exposure. So like mesotheliomas, a lot of people have no idea where they were exposed to asbestos. They just know that mesothelioma is caused by asbestos, so they must have been exposed somewhere. and knowing when to screen and what to screen for, and evaluating the risk for low exposure levels. So the latency, along with the not knowing if you're exposed, makes it really tough to track asbestos-related diseases. So how do we screen for asbestos-related diseases? Luckily in Libby, we pretty much know everyone was exposed. So we ask people to have been here for at least 6 months, at least 10 years ago. The 10 years ago accounts for that 10 years of minimum latency, and the at least 6 months we think accounts for the duration, for the amount of exposure that you would need. So we start with a chest x-ray, and then we do exposure questionnaires, respiratory symptoms questionnaires, health history and tobacco use questionnaires. We do a spirometry breathing test. We do an autoimmune screening, and this was just added in 2019 after we had enough research accumulated that the federal government said, yeah, you can add that to your screening program. Then they meet with our medical provider, and the medical provider may or may not choose to do a CT scan because they're concerned that there might be disease. There's also a colon cancer screening, and that's just it's called a FIT test. So it's not like the whole colonoscopy, it's just a precursor to that. And then tobacco cessation counseling if needed and willing. And then we do outreach and education, and we rescreen or create a plan of care if they do get diagnosed. So the initial Libby asbestos health screening was done by the Agency for Toxic Substances and Disease Registry in 2000 and 2001. They screened 7,000 people in Libby, and 17% of them had abnormal x-rays. They only did x-ray screening at that point. They did some CT screening a little bit later. And ATSDR also looked at the sites where Libby amphibole was shipped to, so that's what that little map down there is. CARDS asbestos health screening. We've done 8,715 of them. 33% of people are diagnosed. 85% of them have environmental exposure only. 90% of them have consented to participate in research. They're about 50-50, 54% females, almost entirely Caucasian. 66% of people that come through our screening program do report some sort of symptoms like chronic cough. 26% have an abnormal breathing test. And one last thing that's really neat about Libby is the EPA declared Libby an environmental public health emergency in 2009, and we're the only site ever declared a public health emergency by EPA. So what that did is when the Affordable Care Act passed, it included a provision that provides public health emergency sites with federal health care assistance. So between those two things, Libby has some special provisions. And that is that we have the screening grant that CARD is funded through. We have Medicare eligibility. So if you're diagnosed with an asbestos-related disease in Libby, you usually have to be 65 to get on Medicare, but you can get on Medicare whatever age you are when you're diagnosed. And then there's a pilot program for asbestos-related disease that covers things that Medicare doesn't. So that's like snow shoveling or gym memberships, that sort of thing. So this is just my last slide with the summary. Asbestos is not banned in the United States. It's legal if it's less than 1% in any product. Regulations apply to only certain fibers and particles based on past commercial use. So many mineral fibers may present similar health effects, but they're not regulated. Materials testing, negative for asbestos only means that they tested negative for those 6 regulated asbestoses. And Libby amphibole is not usually one of them. You have to request that separately. Different health effects can result from different fibers. Legacy asbestos and naturally occurring asbestos are the primary public health concerns moving forward. So that's environmental versus occupational exposures. Identification of disease is not always clear cut. Asbestos is undetectable by humans. And there's a long latency, which makes it really difficult to monitor and study. Libby, Montana is EPA's only public health emergency, but others could be declared public health emergencies. And so what's happened in Libby could happen in other towns that have toxic exposures. And very small amounts of exposure can lead to disease. That's at 0.000009 fibers per cc. And that's everything.
All right,
Right.
thank you. Go ahead, Curtis, you want to lead the Q&A?
Sure. Yeah. Thanks, Tracy. If we were all, in person today, you would hear a round of applause for that presentation. So thank you. And we do have a few minutes for questions. And I noticed that Pam Whitney has a question in the chat, and I'll either read it or let Pam unmute and ask it herself if you're still there, Pam.
Yes, I'm still here.
Great.
So that was a wonderful presentation. So I'm curious about any other minerals that are of health concerns for people, especially minerals that could have that could contain possible asbestos-like fibers. So I'm from a part of the country in Georgia that mines a lot of kaolin, and I've always been concerned. So just wondering if you've come across anything about kaolin.
Unfortunately, no, I've never heard of that, but I'm gonna Google it after this. I'm sorry.
Okay, yeah, no, yeah, kaolin's, and it's a type of a clay. It's a white clay, and it's used for cosmetics, ceramics, medications, things like that. And actually, in Georgia, between Augusta and Macon, is one of the biggest kaolin mining areas in the world. And so I've always wondered if there's some down the road health effects. So just wondering with your research if you've come across anything.
Yeah, I mean, the only thing that I can share is that pretty much they say just do the research on every fiber, which of course is impossible, right?
Yeah.
That's the thing with asbestos substitutes too. You have to test to make sure they're safe before you start using that instead of asbestos, but it's just so time consuming and costs so much money. So I don't know if you've looked into if anybody else has tried to do that research or not, but I would say don't ever assume it's safe based on Libby's experience.
Right, right. Thank you.
Thank you.
Hi, Tracy. This is Laura. Nice presentation. Hey, I was curious, what are the screening recommendations for Libby residents now that the community or those operable units have been delisted? Well, yeah, what are those screening recommendations for residents? Has it changed?
The screening recommendations haven't changed like based on ATSDR and CDC criteria. We've gone from like testing every year to testing every 5 years, just because exposure levels are a lot less now. But there's still, like I said, the asbestos was put in walls and it was just left there because it was sealed in. So as people start to demolish and they start to reconstruct or replace their windows or whatever, there are still exposures happening. There's also places that weren't cleaned up. The people wouldn't let EPA in for whatever reason. We've got about 450 of those properties around. And the mine work is still happening. So there are still exposures, but our area is definitely safer than most. So that's nice.
Yeah.
Hey Tracy, nice presentation. It's really interesting to hear some of the history about this. And I have a question maybe about a little bit bigger public health perspective on this. And, you mentioned that a lot of people, are DIYers and do their own work in their house. And maybe people in Libby are a little more aware of some of the risks of that. But thinking past that in Montana and the US, are there educational programs to raise awareness about, things like that, exposures in your home and because you listed off a lot of different items about, different exposure sources in the home that I'm sure many people don't even realize. And so what kind of avenues are there to get people more aware of those types of things? Do you have a sense of that?
That's a wonderful question.
That's the $100 billion question.
Yes, exactly. I mean, that's why we go every year to like APHA, but honestly, we're the only asbestos people there, and it is a huge exhibit hall. I think that mostly people think asbestos is a thing of the past and it's not really something to worry about. And unfortunately, our funding is specific to Libby Amphibole. We can do a little bit of outreach and education outside of that. But we were actually trying to create a center of excellence that was more on a national scale for all asbestos education because there isn't much out there.
Great. Thanks, Tracy.
Thank you.
Well, great. Unless there's any other questions, I mean, we have 1 minute left if someone has a burning question. Otherwise, So you can chime in, or you can certainly send Tracy an email at your leisure. I'm sure she'll field any questions that come her way. So Damien, unless you got any closing thoughts, maybe we'll just thank Tracy for a fantastic and informative presentation.
Yep,
Thanks, everyone.
that's it. Thank you, Tracy, and we'll see everyone next week.